Hello everyone, my name is Melanie and I'm a part of your benefits brokerage team, and today I'm going to be going over your 2024 benefits. This message is providing an overview for what this booklet contains. It summarizes your benefit options and directs you to the resources that you can get your questions answered. All the plans demonstrated in this document meet the minimum essential health benefits and affordability requirements as set forth by the healthcare reform. If you have any questions about any of the benefits here, you can always reach out to a member advocate. We have a page giving you the contact information where you can reach out to your HR team. And with that, let's get started. This and the following 2 pages provide an overview of healthcare terminology that may be useful to understand before you get into the booklet, or you can always reference back in case you have specific questions. This page has medical. Here we have dental. And lastly, we have prescription drugs. So employees are eligible to elect for benefits during the open enrollment period, which runs from December 1st, 2023 to December 15th, 2023. So you have just over 2 weeks to go in and elect. In general, full-time employees working 30 hours or more per week are eligible for benefits, as well as eligible dependents. So that can include your children who are 26 or under, your domestic partner, your spouse. If you have any questions or concerns regarding if your dependent is eligible, you can always reach out to your HR team or that member advocate that we talked about before. So enrollment, if you are a new employee, then your coverage will begin on the first of the month following the date of hire. So if you were hired January 15th, then you'll be eligible February 1st. If you don't go in and elect any coverage, you will be considered waived of benefits for the plan year, and you won't be able to enroll again until the next open enrollment period. If that's the case and you don't enroll, you will still be automatically enrolled for basic life and AD&D, the MetLaw legal short-term and long-term disability insurance at no cost to you. Once we get to the open enrollment period on December 1st, employees who did enroll or did not enroll at their initial eligibility period, or if you waived coverage, then you can make changes for the 2024 plan year once a year at open enrollment. So if you're currently covered and you want to make changes, or if you didn't elect and you want to make changes, you will be able to make those changes from December 1st to December 15th. If you happen to want to make any changes throughout the year outside of open enrollment, you can only do that if you experience a qualified life event. We have a list of some examples of what these are, but if you think you've experienced a qualifying life event that's not listed here, again, you can always reach out to your HR team or to member advocate, and we can help you determine legally if you're able to make changes. That being said, if you do experience a qualifying life event, you must elect to have those changes made within 30 days of it happening. So if you're not quite sure if you're eligible for this, always just ask the question and reach out so that you can make changes if you're eligible to. Like prior years, you will be using EASE to elect your enrollment changes or elect for the first time. If you're a new employee, you should have received an email to set up an account, but if you didn't get that, reach out to the member advocate and we can have that resent for you so you're able to log on and make your benefit elections. We have instructions here that provide a walkthrough. It's pretty intuitive either way, but if you have any questions, always reach out. So Cutler Group provides many different medical plans to choose from. Some of them include PPO plans and some of them include HMO plans. The main difference between PPOs and HMOs are with PPOs, you're able to see specialists without a referral from your primary care physician, whereas with HMOs, you can only see them if you have a referral. And in addition to that, PPOs do provide some level of coverage for providers that are not within your network. It's lower than the cost within the network, but HMOs do not provide any coverage out of network unless it's a true emergency and you're going to an emergency room. We'll go over each of these plans in detail later on, but it's important to keep that differentiation in mind as you're choosing the best plan for you and your family. So all the plans that we're going to review today cover preventative care services at 100%. We have a list of the common services that are included in preventative care, but there are more services that could be included. Your doctor will let you know. But if you go in for a preventative screening and a condition is found, it wouldn't be considered preventative anymore. It would actually be billed as diagnostic. So that's an important differentiation. But in general, preventative care is covered at 100% in network. All right, so we have multiple Blue Shield medical plans to review. I'm not going to go over all of these in detail because I don't want to talk your ear off when all the data is right in front of you. And in addition to that, when you do go into ease and elect, the SBCs, the summary of benefit coverages will be available to you to review. All this information will be there, but this is sort of a condensed version of what each of the plans provide. They give a highlighted overview of each of the coverages. So for the sake of time, we'll go over the deductibles, the out-of-pocket maxes, and just the basic primary care office visit costs. But if you want expanded versions, again, those SBCs will be in ease. And if you want to go over any of this individually, you can set up a time to meet one-on-one with one of us at the member advocate team, and we can go over these with you and answer any questions that you have. So both of these plans are tandem plans. They have in-network and out-of-network benefits. As you can see, the in-network benefits are significantly cheaper than the out-of-network. So you're going to be paying either a little bit more or substantially more out-of-network, depending on the visit type. So for the Platinum Tandem PPO, there's a single deductible in-network of $250 and a family of $500, with the out-of-pocket max, again, for single $4,300 and family $8,600. Your office care is covered at $15 for a copay and $30 for a specialist. And the Silver Tandem PPO savings, the annual deductible is much higher for an individual. It's $2,300 and for a family $4,600, with an out-of-pocket max of $7,900 and $1,500 for single and family respectively. And then for in-network, your office visit is going to be covered at 30%. And the specialist would also be at 30%. Excuse me, that's the coinsurance. So you'd be responsible for 30% for both the office care and the specialist. That's not how much the insurance would cover. So rather than a copay, you have a coinsurance of 30%. And here we have the full PPO plans. So for the Platinum Full PPO, the individual deductible is $250 with a family of $500. The office visit is a $50 copay and specialist is $30. And the Silver Full PPO savings has an annual deductible of $2,300 for an individual and $4,600 for a family. And once again, a 30% coinsurance for both office visits and specialty visits. So the final Blue Shield medical plan offered to you is an HMO. So again, that means that out-of-network services aren't covered unless it's an emergency room visit. You do need a referral in order to see specialists. And so for this plan, there's an annual deductible of $0. So there is no deductible. There's an out-of-pocket maximum for individual of $2,300 and family $4,600. So that means if you spent enough on your copays or coinsurances to reach that $2,300 or $4,600, then you essentially wouldn't be paying anything at all beyond any benefits or any sort of services that you receive after the out-of-pocket maximum has been achieved, but there's no deductible that you'd need in order to only pay the minimum copay. Lastly, as far as medical plan offerings go, there's Kaiser Medical, which is also an HMO. You have no deductible. You have an out-of-pocket max of $3,000 for an individual, $6,000 for a family. An office visit is a $10 copay, and a specialty visit is $20. Similar to the last HMO, out-of-network coverages are not provided unless it's an emergency room stay. So a commonly asked question amongst HMOs and Kaiser specifically is if you'll be covered if you need care while you're traveling. And this page outlines that yes, if you truly need care, if you're in an emergency, you can go to any state Kaiser facility, or if you need to go to a minute clinic or urgent care or emergency room, that is okay. You will still be covered. Obviously, if you wanted to see a specialist or just see a random doctor, you wouldn't be able to coordinate that unless you had a referral to do so. But if you are in a state where you need emergency care, you can go to a non-Kaiser facility and it will still be covered. Something really great about all of the plans that are offered is they do provide virtual care, telehealth options, and that's for both Blue Shield and Kaiser members. For the Blue Shield plans, their virtual care is offered through Teladoc, and for Kaiser members, it's offered through their website, My Doctor. This page is a good reminder of when you should use urgent care and when you should use the emergency room. The costs for either are significantly different, and you definitely don't want to wait for an emergency by going to urgent care if it's a true emergency, but you also don't want to go to the ER if it could be handled at urgent care, just to save yourself the large copays of, I think, like around $200 and up for these plans. Also, both Blue Shield and Kaiser have nurse lines available 24/7 if you want to talk to a medical professional before making your decision or to try and determine the best care possible. Obviously, you know yourself best, and you can take all of this information as just informative for you. You know yourselves best, so always do whatever you want to do for your own health. But there are different reasons to go to the ER in urgent care. Your dental benefits have not changed at all since the last year. They're still very rich. There is an in-network deductible of $50 for an individual and $150 for family, with a plan maximum of $3,000. There's no charge for diagnostic and preventative care. There's no charge for basic services, fillings, root canals after you've paid your calendar year deductible. You'd pay 40% after the deductible for any major services, and there are orthodontic services too in this plan. You'll pay 50% of those, and the deductible is waived from that benefit. So this is a really rich dental plan available for you and your children. Both adults and children are covered in this plan, which is fantastic. Again, your vision benefits are also very robust. There's no charge for an exam. You can get one every 12 months. Eyeglass lenses, vision lenses, bifocals are all covered at no charge. You can get one every 12 months. You get $180 for frames plus 20% off of the remaining balance. You can get those once every 12 months. And for contacts, you get an $180 allowance after a $60 copay. Once at 12 months, that's in lieu of frames and lenses. For this benefit, out-of-network is more expensive than in-network. You get a reimbursement up to $45 for your exam every 12 months, and you get reimbursed for $70 for any materials that you get after a $20 copay. Vision lenses, a $30 reimbursement, bifocal lenses, $50 reimbursement, trifocal lenses, $65 reimbursement every 12 months. It's important to note that with frames for out-of-network, you'd only get those every 24 months, and that would be a reimbursement up to $70. So it's definitely, if you're able to go in-network, you'd be saving yourself a lot of money and you'd be getting more of that rich benefit. We do have a contact page that has a phone number and a website for MetLife where you can go and look up to see a list of providers, or you can call and see if your vision provider that you have is in network, but the carrier and the provider hasn't changed. So unless, if you're seeing the same person from prior years, unless they've notified you that they're out of network, you should be good to go. Your employer pays for a life and AD&D benefit. Basic life insurance essentially pays your beneficiary a lump sum if you pass away, and AD&D provides another layer of benefits to either you or your beneficiary if you suffer from loss of limb, speech, sight, or hearing, or if you were to pass away in an accident. The cost of this is paid in full by your company. It's provided through MetLife. If you want to receive the benefits of this, you definitely want to go in and make sure that you designate a beneficiary. You will need their social security. You'll have to indicate their relationship to you and have basic information about them for them to be qualified as your beneficiary to receive the benefits. But we definitely recommend you go in and make sure that you designate that in ease. So you don't need to go in and elect this or enroll in this. You're already enrolled, but you definitely want to go in and make sure that you designate a beneficiary or make sure that the beneficiary is correct. If you have any questions on that, just email the member advocate or you can call us and we can answer any questions for you. So as a Cutler employee, you also get automatically enrolled into a short-term disability and long-term disability plan, also completely paid for by your employer. So short-term disability coverage pays you a benefit if you're temporarily unable to work because of an injury, illness, or maternity leave. It can cover you for up to 12 weeks with a maximum weekly benefit of $3,000. And long-term disability pays you 60% of your base income if you can't work because of an injury or illness that prevents you from performing any of your job functions following a 90-day short-term disability period. And this would cover you 90 days after your disability, with a monthly maximum of $13,000. So if you qualify for either of these coverages and you need any help submitting a claim, reach out to a member advocate, or if you want to understand more of how these benefits work, we can set up a call to chat with you about it as well. Another great benefit provided to you that's completely covered by your employer is the MetLife Legal Plan. There are so many things that this plan offers to you as an employee. So this is basically like having an attorney on retainer for you. So as you can see, there's a list of covered services and not covered services. A few that I want to highlight, if you want to plan your will or do estate planning or do trust planning, you can meet with a lawyer that can help you coordinate, what needs to happen, how to write it, any sort of small claims, civil lawsuits, personal injury, bankruptcy, immigration assistance, home equity loans. There's so much that you can get out of this benefit. So if you're ever in the need for legal services and you want to save yourself thousands of dollars, you can at least start here with getting some of your affairs in order. Another benefit offered to you, but you are not automatically elected into, is voluntary MetLife pet insurance. This is just what it sounds like. It's health insurance for your fur baby. The coverage can include many things. You can also sort of pick and choose what it covers to adjust your price. It's important to note that this is it's sort of offered through your employer, but it's not covered by your employer. So any election that you make or any coverage that you enroll your pet in, you will be responsible for the cost of that. To get a quote or to enroll, you can visit the website at the bottom or call the phone number. The quotes are going to vary depending on your pet species and current health condition and probably a ton of other things. So if you have any questions or you want to see what it would cost, just give MetLife a call. So as I've referenced multiple times during this presentation, you have a member advocate available to you that's offered through our company, ICMS Benefits. This is offered to all Cutler employees and your dependents. You can email us, you can call us, you can set up a time if you want to get on a face-to-face chat. We can help you with so many things: general plan inquiries, billing explanation and support, dispute resolution, claim reconciliations, explanation of benefits, so much more. If you can also reach out to us, and if we can't help you, we'll just tell you where you can go to get what you need. We're here to support you understanding your benefits, getting claim help, everything. So not only is this useful for you during open enrollment if you have questions on the plans, but you can also reach out to us any time of the year, throughout the year. If you have a qualifying life event, reach out to us, anything. This is an important page. This is your plan contact page. This goes through every line of coverage and tells you the websites, the emails, all policy numbers and group numbers, which are good to have on hand if you're calling about a claim. Keep this handy throughout the year. You'll probably refer back to it if you do have to make inquiries about your specific coverage. And that wraps up this presentation. Thank you for being here for me. As always, if you have questions, reach out to us, a member advocate or your HR team. As a reminder, open enrollment is from December 1st through December 15th. And beyond that, happy holidays. I hope you have a great 2024, and we look forward to hearing from you.